Hey, welcome to Roads to Forever. I'm Terry, and in today's video, I'm answering your question, do stomach ulcers go away on their own, and what happens if left untreated? And if you haven't seen any of my other stomach ulcer videos, don't worry, I'll make sure to link them in the description box down below and also in the YouTube cards so you can check them out after this video. And in those videos, I show you how I was able to heal my stomach ulcer with natural remedies, no medicines, and I walk you through what my stomach ulcer menu looked like. But in this video, I really wanted to address this particular question of do stomach ulcers go away on their own, because this is something that comes up often in the comments on my other stomach ulcer videos. So before we dive in and answer that question, let's do a quick recap about stomach ulcers. So stomach ulcers, which you'll often see being referred to as peptic ulcers, are really just painful sores that will develop along the lining of your digestive system. And in general, they'll form in the stomach, but there are times where ulcers will actually develop at the top portion of your small intestine, and these are called duodenal ulcers. Now, in terms of ulcers, they really form because maybe you have excessive stomach, acids or bacteria or any other type of toxin that comes in and causes damage to the lining of your digestive tract. And really what's happening is that these stomach acids are really just eating away at the protective layer of your digestive tract. And so obviously this is going to, for some individual, cause you to have these different symptoms. And some people may not have any symptoms at all, but some others may feel this discomfort or a burning pain. And some of those discomfort may be, right around the area between your belly button. And if you have an empty stomach, you'll definitely notice it a lot more. And so you'll maybe eat something and it'll go away. And then maybe a few hours later, then the pain comes back. And so, you might have this feeling of being bloated, or maybe, you're nauseous. Or sometimes if you are going to the bathroom and you look in the toilet, you'll notice that your poop looks really dark. And so that's when it's an alarm to you, like, wow, I really need to go get this checked out. All right, now that we've had a brief overview of peptic ulcers, let's now answer the question of do stomach ulcers go away on their own? So yes, some ulcers may actually go away on their own. However, they can also return. So if you leave these ulcers untreated, they can actually lead to different complications, which I'll talk about in a minute. So even though the symptoms may go away, you definitely want to make sure that you're following up with your healthcare provider, because in some instances, they may definitely come back. Even if you are receiving treatment for your ulcers, you may have to go back in again and see your healthcare provider and have additional treatment to deal with your ulcer. So again, it just really depends, and that is person to person. But I did want to let you know that there are instances where your ulcers can actually heal on their own, but there are other times when you can expect them to come back and you will need additional treatment. So that's something to definitely keep in mind. So if left untreated, you can actually develop what's known as a perforated ulcer, which is basically you have the contents of your stomach eating through the mucosal lining. And so as a result, this can be an even more serious complication. And so this is obviously a situation where you would need to, meet with your healthcare provider right away or go to the emergency room, because this can be life-threatening. Another complication that can come from leaving an ulcer untreated is you'll develop what's known as internal bleeding. And so again, that's also life-threatening. And so, if you are bleeding internally, you may actually at some point need to get a blood transfusion. So it's really important that if you are having symptoms related to an ulcer, that you follow up with your healthcare provider and have the proper diagnoses so that you can know exactly what is going on. Because, like I said in a prior video, with an ulcer, there are different symptoms, there are different causes. And so whether or not you have an ulcer related to your overuse of non-steroidal anti-inflammatories, things like ibuprofen, aspirin, Motrin, or you have an ulcer that's related to the H. pylori bacteria, obviously the treatment for those are going to be a little bit different, because with H. pylori, you're definitely going to need some type of antibiotic. But again, you want to make sure you're following up with your doctor to find out what the best course of action is for you. I hope this short video has been helpful to you and answered your question about what happens if you leave your stomach ulcer untreated. If you enjoyed this video, I ask that you give it a thumbs up, share with your friends, and subscribe for more awesome content just like this. Before you leave, I want to remind you, you're only one prayer away. Thank you so much for watching, and I'll see you in the next one. Bye. Take care.